Hello and welcome to Clearing the Path, a clinical framework for supporting detox pathways in root cause clinical practice. My name is Adair Anderson. I'm the product marketing educator at Vibrant Wellness. I'm also a registered dietitian with a private practice called Eating with Integrity, where I resolve functional gut disorders like IBS. I earned an undergraduate degree in biochemistry, a master's degree in clinical nutrition from Bastyr University, and I've also completed advanced testing in functional medicine through the Institute for Functional Medicine. Here's our agenda. First, we'll do an overview of toxic burden in the modern world. Then, I'll introduce you to Vibrant's Total Tox Burden test, a great way to identify toxin burden in your patients, and highlight the gold standard methodology we use to measure each analyte. Then, I'll share my 4-step framework for supporting detoxification. And we'll follow a case study through that 4-step framework using the Total Tox Burden, Hormone Zoomer, and Gut Zoomer results. Finally, we'll end with a summary. We live in a toxic world. The Environmental Protection Agency, the EPA, inventory contains roughly 84,000 chemical substances, many of which have limited testing for their singular effects on humans or the environment. The burden of toxin exposure is increasing, including exposure to persistent organic pollutants, heavy metals, mycotoxins, plastics, and pesticides. These chemicals, toxins, and metals are in our air, the food we eat, the water we drink, and our home environments. And the impact? Chronic exposure can result in chronic inflammation, mitochondrial dysfunction, endocrine disruption, immune dysregulation, and gut barrier compromise. To best help our patients, it's crucial to consider the total load, in other words, the total body burden, and its cumulative effect on health outcomes. This is why we need precision assessment. Guessing or relying on symptoms alone is not enough. Good news, Vibrant Wellness has a solution. Our Total Tox Burden bundle is a comprehensive panel measuring the levels of 20 heavy metals, 29 mycotoxins, and 38 environmental chemicals being excreted from the body via urine. This test provides detailed insights into toxin accumulation and exposure, helping guide personalized detoxification strategies that reduce health risks associated with environmental and chemical toxins. How accurate are the results? Well, mass spec is the gold standard for detection of small molecules. Therefore, Vibrant uses liquid chromatography tandem mass spectrometry, or LC-MS, for quantitative detection of mycotoxins and environmental toxins, and also uses inductively coupled plasma mass spectrometry, or ICP-MS, for detection of heavy metals. These are powerful analytical techniques that combine the separating power of liquid chromatography, or ICP, with the highly sensitive and selective mass analysis capability of triple, quadruple mass spectrometry. And note, the results are corrected to urine creatinine to account for urine dilution variations. The Total Tox Burden identifies sources and categories of toxin exposure, helping you individualize detox protocols based on real biochemical data. Here are the markers found in each panel. The heavy metal test includes 20 heavy metals. The mycotoxins test includes 5 aflatoxins, 11 trichothecenes, and 13 other mycotoxins, including ochratoxin A. And the environmental toxins panel includes environmental phenols, parabens, phthalates, herbicides, pesticides, volatile organic compounds, and other markers. In other words, the Total Tox Burden provides a comprehensive view of a patient's total toxic burden. Okay, so let's say you order the test for the patient, and you've just looked at their results. You see they've got 4 highly elevated toxins and 4 moderately elevated toxins. What do you do next? Where do you start? I've spent a lot of time thinking about best practices for detox, and I'd like to share my framework for supporting detoxification pathways, and it includes 4 steps. The first step to support detoxification is to reduce exposure to toxins. The second step is to increase excretion of those toxins by promoting phase 3 detoxification, excretion via sweat, urine, or stool. In other words, making sure the patient is having regular bowel movements, is staying hydrated, and in some cases, using sweat to assist excretion. I work on the liver last, supporting phase 2 conjugation pathways before upregulating phase 1 activation reactions. For those who are new to detoxification, you might think this looks a bit backwards. Why do phase 3 before phase 2 and phase 2 before phase 1? Great question. I'd love to tell you all about it. So most toxins are fat soluble. So to facilitate, the liver converts fat-soluble compounds into more water-soluble or polar compounds so they can be eliminated via the stool, urine, or sweat. And the liver does this via a multi-step process. In phase 1 detoxification, the liver actually activates hormones and toxins, making them more toxic. These activated intermediates produce reactive oxygen species which can damage DNA, lipids, and proteins. Here's an analogy. Imagine hormones and toxins like dust on your floor. Phase 1 is sweeping the dust into piles. Some of the particles get into the air and end up irritating your eyes and your nose. Which is why detoxification requires ample antioxidant support, such as vitamins A, E, C, CoQ10, zinc, selenium, and bioflavonoids. In phase 2 detoxification, the liver attaches a big water-soluble compound like glutathione, glucuronic acid, or a methyl group to hormones and toxins, making them more water-soluble. So back to the analogy, imagine phase 2 like transferring the dust piles into garbage bags, basically bundling the toxins into a form that can be carried around throughout the body without causing irritation. Finally, in phase 3, the body excretes the water-soluble metabolites via the sweat, urine, or stool. For our analogy, this is when you remove the garbage bags from your house by taking them to the dump. When detoxing, order is important. It's best to start with phase 3, ensuring the patient is regularly taking their trash to the dump. Next, upregulate phase 2. Make sure the patient has enough garbage bag to remove the dust piles. Otherwise, you're just agitating the dust for no reason. Once you've ensured no bottleneck at phases 3 or 2, you can speed up phase 1 to match. In other words, only start sweeping if you know you can quickly remove the dust from the house. Of course, you can always support all 3 at the same time. Just ensure you don't upregulate phase 1 without phase 2 or 3, otherwise you'll build up those toxic intermediates. As a cautionary tale, this buildup of toxic intermediates is what happens when you take acetaminophen, commonly referred to as Tylenol, and then later drink alcohol. The body thinks alcohol is more dangerous than Tylenol, so it stops processing the acetaminophen in favor of getting rid of the alcohol, leaving behind even more toxic intermediates. In fact, acetaminophen overdose has surpassed viral hepatitis as the leading cause of acute liver failure. And note that taking supplemental N-acetylcysteine, or NAC, prior to drinking alcohol or while taking Tylenol can protect the liver from the negative impact of these substances. Now, to help us better visualize and apply this framework, we're going to follow a case study through each step. Meet Roya. Roya is a 42-year-old female. She is 5'7", weighs 150 pounds, making her BMI 23.5. Roya has a high-stress job as a project manager, uses conventional beauty products, frequently drinks from plastic water bottles, and wears a plastic night guard every night. She gets poor sleep, eats a diet high in processed foods, including ordering carry-out multiple days per week. Roya's main complaints are fatigue, brain fog, painful periods, and GI symptoms like gas, bloating, and constipation. She only has bowel movements 3 or 4 days per week. Her main concerns are that fatigue and brain fog are negatively impacting her work productivity. She also reports worsening PMS symptoms. Roya's Total Tox Burden results revealed high levels of BPA, propylparaben, and the volatile organic compound 2-HIB, 2 phthalates, 2 mycotoxins, and 2 heavy metals, barium and lead, plus moderately elevated levels of cadmium and butylparaben. In other words, she has significant toxic burden on her liver and her body. Now, toxins contribute to oxidative stress and can result in mitochondrial dysfunction. They can also overwhelm normal biotransformation processes in the liver. And since hormones are detoxified in the same pathways as toxins, this can result in symptoms of estrogen excess like breast tenderness, heavy bleeding, and increased cramping during menstruation. Not surprisingly, Roya's hormone Zuma results revealed high levels of estrogen, favoring detoxification via the potentially genotoxic 4-OH pathway, as well as sluggish methylation, indicating her phase 1 and phase 2 pathways could use some support. Meanwhile, Roya's gut tumor results showed high levels of beta-glucuronidase producing bacteria and high levels of beta-glucuronidase. This means the toxins that undergo successful glucuronidation in Roya's liver and are successfully dumped into her intestines for elimination are getting deconjugated via the overgrowth of beta-glucuronidase producing bacteria in her gut. In other words, those bacteria produce beta-glucuronidase, which removes the big water-soluble glucuronic acid and sends the toxins back to the liver via the hepatic portal vein. I mean, imagine how the liver feels. It's like, hey, I just deconjugated this toxin. Why are you sending it back to me? And this can happen more than once. Maybe the same toxin is making a second, third, or fourth round of biotransformation in the liver before it can finally leave the body, adding additional burden to Roya's detoxification system. Thinking about Roya's total toxic burden, hormone zoomer, and gut zoomer results, how can we best support her detoxification pathways using this clinical framework? Well, let's start at the top. The best way to support liver detoxification is to first reduce exposure to toxins. Another way to think about this is that we want to turn off the faucet and stop putting water into the tub. If the drain is clogged or slowed, and the water is flowing into the tub faster than the drain can drain, that's when the rest of the body's detoxification systems kick in and try to help, which can manifest as eczema or other skin rashes. So the first step is to identify exposure and remove or at least reduce those exposures. Identify exposure is best done alongside the patient. The patient intimately knows what their diet and lifestyle looks like. However, it can be helpful to prepare for the appointment by reviewing the report comments that Vibrant includes with all elevated total tox burden markers, as well as reviewing our interpretive guides. You can learn about sources of environmental toxins in the Environmental Toxins Interpretive Guide. You can learn about heavy metal sources in the Heavy Metals Interpretive Guide. And you can learn about mycotoxins and mold species in the Mycotoxins Interpretive Guide. When meeting with Roya, I learned that, in addition to her regular use of plastic water bottles, a source of BPA, and conventional beauty products, which are full of parabens and often phthalates too, and reliance on carryout, also contributing to her BPA load, I also learned that she grew up in a house with lead paint, and that she'd recently had an X-ray with contrast medium, which is a source of barium. And she spent time in a country that still uses MTBE in their gasoline, which gets metabolized into 2-HIB. Oh, and she was eating several foods that are often contaminated with aflatoxins. Once you reduce the flow of toxins coming into the body, the next step is to increase the flow of toxins leaving the body. This is done by promoting phase 3 detoxification, i.e. elimination via the urine, sweat, or stool. Or all three, ideally. What I mean is helping your patient have 1 to 3 bowel movements a day, stay hydrated, and maybe even add sauna therapy to increase their elimination of certain toxins via the skin. If you remember, Roya was only having 3 or 4 bowel movements per week, so she definitely needed help increasing phase 3. I find the 2 biggest drivers of constipation are inadequate fiber intake. You do need bulk to help push the food down the tube, and inadequate energy intake. In other words, the body will slow digestion and motility to extract every little bit of food in what you eat if you're not eating enough. I talked to Roya about adding more plants and variety to her diet, which also had the added benefit of supporting her microbiome diversity, because the more types of fiber you eat, the more types of microbes you support. And of course, anytime you increase fiber intake, be sure to increase hydration to match. Roya, thankfully, found joy in increasing hydration by investing in a new high-grade stainless steel water bottle, one that had insulation to keep hot liquids hot and cool liquids cool. In the short term, we also added a magnesium citrate supplement to help pull water into her gut, making her stool softer and easier to pass. By the end of this phase, Roya was having daily and sometimes twice a day bowel movements. Since Roya had high levels of lead and moderately elevated levels of cadmium, I also encouraged her to do sauna therapy and sweat, which has been shown in this 2021 review article by Dr. Rhonda Patrick and Dr. Teresa Johnson, to facilitate higher excretion of some heavy metals compared to elimination via the urine. Specifically, lead showed a 17-fold higher excretion rate, and cadmium showed a 25-fold higher excretion rate than urine. Once you confirm and support toxins leaving the body, the next step is to support your liver by upregulating phase 2 conjugation reactions, specifically to make the fat-soluble toxins more soluble in water. Again, I like to think of this step like bagging the toxins so they can be transported out of the body. We all know it isn't healthy to touch toxins, but once they're conjugated into bags, then it's safer to send them into the gut, into the kidneys, or into circulation. However, in order to bag toxins, we first need more bags. Those bags are glutathione, glucuronic acid, acetyl, amino acids, methyl groups, and sulfur. Most of the time, this support is done via supplementation, sometimes hard to get all those nutrients through food alone. For example, you can give your patient glutathione directly, usually via liposomal glutathione, or by giving the precursors, such as the rate-limiting cysteine as NAC, or sometimes alongside glycine as GlyNAC. To support methylation, we give methyl groups. Yes, methylated B vitamins like methylcobalamin, but also glycine as TMG, trimethylglycine, or as ephidiacyl L-methionine or SAN-E, a crucial methyl donor in the body. We know Roya needs methylation support because her hormone zoomer indicated very low methylation activity. In addition to the supplemental inducers, page 56 of Vibrant's Environmental Toxins Interpretive Guide includes food sources of nutrients to support methylation, including meat, poultry, Brazil nuts, pumpkin seeds, and soybeans for methionine, and quinoa, beets, and spinach for betaine. Seeing this information helped Roya add those foods into her diet. We also need to support Roya's glucuronidation pathway because all the environmental toxins on our Total Tox Burden results are eliminated via that pathway specifically. Good news, this handout, Vibrant's Environmental Toxins Specific Detox Pathways, is available to all Vibrant ordering providers in the Education Center tab of Vibrant's provider portal. So inducers of glucuronidation includes foods like cruciferous vegetables, resveratrol foods like grapes, ellagic acid foods like berries and pomegranate and walnut, and ferulic acid foods like tomatoes and asparagus, as well as astaxanthin foods like salmon and trout. Since Roya had high levels of beta-glucuronidase and beta-glucuronidase-producing bacteria on her gut tumor, I also recommended she take some calcium D-glucarate. While you get D-glucaric acid from food sources like mung bean sprouts or aduki bean sprouts, most clients find it helpful to take therapeutic doses available via supplemental form. For those who don't know, calcium D-glucarate blocks the beta-glucuronidase enzyme. In other words, it prevents gut bacteria from taking all the dust out of the bags and sending that toxic dust back to the liver for reprocessing. Obviously, the long-term goal is to correct the dysbiosis leading to increased levels of the beta-glucuronidase-producing bacteria and the beta-glucuronidase enzyme. However, supplementing with calcium D-glucarate in the short term is a great way to prevent deconjugation and recirculation of toxins and excess hormones. Speaking of hormones, calcium D-glucarate is contraindicated for patients with low estrogen levels. However, I was not worried about this in Roya's case since she had high estrogen levels and symptoms of estrogen excess. So once phase 2 has been turned on and the patient has all the raw materials to make conjugation bags, the final step is to support phase 1 activation. Specifically, to activate toxins, essentially making toxins more toxic, which creates a docking point for the conjugation reactions to place the big water-soluble compounds to cover the toxin, making it more hydrophilic. In other words, we bring the toxins into piles so they can be put into a bag. And this requires the right kind of broom, and can also have the negative side effect of stirring up the dust into the air and irritating our eyes and nose. So we know Roya needs phase 1 support because her phase 1 estrogen metabolism ratios indicate she is favoring the potentially genotoxic 4-OH pathway. In fact, 37% of her estrogen is going down this pathway when it should only be 8 to 16%. And at the same time, she's underutilizing the more protective 2-OH pathway, Only 49% of her estrogen is going down this pathway when it should be 55 to 75%. So, what can we do to shift pathways? Well, several things, including DIM, quercetin, NAC, resveratrol, and sulforaphane. However, the answer is almost never black and white, as these compounds don't just impact one pathway, but multiple pathways. So keep that in mind as we review them. Diindolylmethane, or DIM for short, binds to aryl hydrocarbon receptor and induces mostly the cytochrome 1A1 or yellow 2OH pathway. However, it also activates the cytochrome 1B1 or pink 4OH pathway, but much less compared to the cytochrome 1A1 activation, according to cell, animal, and human studies. DIM also induces the AKR, the aldoketoreductase superfamily, the NRF2, nuclear factor erythroid 2, and the ARE, the antioxidant response element. When doing this, it increases glutathione S-transferase, or GST, and NADPH quinone oxoreductase and QO1, according to animal cell studies. In other words, it helps increase phase 1 and also phase 2. Quercetin, on the other hand, is a potent cytochrome 1B1, again the 4OH pathway, inhibitor, and a less effective inhibitor of the cytochrome 1A1 and 1A2. It has a high bioavailability of flavonoids, 20% when taken orally, and is very helpful in many other things, including reducing histamine and pro-inflammatory cytokines. However, please note that it can slow COMT in phase 2. Now let's talk about N-acetylcysteine, or NAC for short. NAC prevents damage to DNA by inhibiting formation of catechol-quinones and or reacting with them. It can support the formation of glutathione for more antioxidant support. However, NAC is also mucolytic, so be aware of intestinal barrier issues like low short-chain fatty acids, low akkermansia, and or elevated signaling. Resveratrol. First of all, resveratrol is an antioxidant, so it reduces reactive oxygen species. It's also an aryl hydrocarbon receptor, AHR, antagonist, so it inhibits the cytochrome 1B1 pathway specifically. According to the 2017 study by Lee et al., its inhibitory ability for cytochrome 1B1 is over 50-fold greater than against cytochrome 1A1 and 500-fold higher than cytochrome 1A2. Also, resveratrol induces NRF2. Finally, sulforaphane. Sulforaphane reacts with glutathione via GST and activates NRF2 and ARA pathways to induce phase 2 enzymes to convert quinones back to catechol estrogens, the 2 and 4-hydroxy. And here's all the references for phase 1 detoxification support. And a big thank you to Dr. Carrie Jones for compiling these for me via her Connecting the Dots on Female Hormones course. Finally, let's discuss the approaches to address mycotoxins. According to page 34 of Vibrant's Mycotoxins Interpretive Guide, glutathione may play a role in mold and mycotoxin illness, pathophysiology, and detoxification care via its, number 1, antioxidant activity, and number 2, that it's a crucial component of the body's detoxification pathways, and 3, that it plays a role in modulating immune function, which is essential for defending against infections, including those caused by molds and mycotoxins. Additionally, binders are often used for detoxification protocols to attach to toxins and prevent them from being absorbed in the gut and to facilitate elimination. The Mycotoxin Interpretive Guide includes the mycotoxin-specific binding agents table, which is also available as a standalone handout in Vibrant's Purveyor portal. For Roya, I chose chlorella as it has been shown to help bind plasticizers, phenols, and heavy metals like lead and cadmium, and I also encouraged her to start eating oatmeal. According to this 2014 review article in the British Journal of Nutrition, oats are a significant dietary source of beta-glucan, a soluble fiber located mainly in the endosperm of the oat grain. So, what was Roya's final management plan? Well, she started avoiding plastics, including plastic water bottles, receipts, and carry-out containers, and if she did get carry-out, transferring the food to ceramic, plates, or glass storage containers as quickly as possible. I referred her to the Environmental Working Group's Skin Deep database to find alternative body care products. And while the source of her MTBE exposure, which then gets metabolized into 2-HIB, was likely her trip to Mexico, where they still use it in gasoline, I also encouraged her to check her municipal water supply to make sure she wasn't getting it that way too. Also, Roya increased her bowel movements from 3 to 4 per week to 1 to 2 daily by eating enough calories, choosing a variety of high-fiber foods, and taking omega citrate as needed. As for supplements, I had her take calcium D-glucarate to inhibit beta-glucuronidase while we worked to resolve her microbiome dysbiosis. We supported her phase 2 and phase 1 detox pathways with sulforaphane, resveratrol, and liposomal glutathione, as well as methylated B vitamins and TMG, trimethylglycine. I also added chlorella and beta-glucan via oatmeal to help bind the toxins in her gut and support their elimination via her stool. I also recommend she work on stress management by getting a mental health therapist and by taking adaptogens to support her HPA axis. By the end of the program, Roya's multiple symptom questionnaire, her MSQ score, fell from 76 to 24, indicating an improvement in symptoms. She reported more energy, better mental clarity, less bloating, less gas, and way less constipation. Her periods were also much lighter and less painful. She, of course, wanted confirmation of the changes, so we ordered some follow-up lab testing, which confirmed reduced total toxic burden on our Total Tox Burden test results, increased diversity and lower levels of beta-glucuronidase-producing bacteria on her gut zoomer, and her hormone zoomer results showed that her estrogen fell back to normal levels, and improved phase 1 pathway ratios and better methylation. In summary, the best way to support liver detoxification is to first reduce exposure to toxins, then increase excretion of those toxins by promoting phase 3 detoxification, i.e. elimination via the urine, sweat, and/or stool, and to work on the liver last, supporting phase 2 conjugation pathways before upregulating phase 1 activation reactions. Finally, let's tie it all together with this 4-step framework flowchart. So, when you see many elevated toxins on your patient's total tox burden test, step 1 is to identify exposure using Vibran's report comments and interpretive guides alongside patient input, and then have the patient avoid those toxins as much as possible. Step 2 is to ask the question, is phase 3 elimination impaired? Is the patient having 1 to 3 bowel movements daily? Is the patient's urine clear or dark yellow? Are they able to sweat? If any of these elimination channels are blocked, work with the patient to increase elimination via resolving constipation, focusing on hydration, and even considering heat therapy if indicated. Step 3 is to investigate if phase 2 conjugation is impaired. Check methylation via the hormone zoomer. Check beta-glucuronidase levels via the gut zoomer. If phase 2 isn't happening in your patient, upregulate those conjugation reactions with compounds like sulforaphane, TMG, sulfur-containing foods, increasing antioxidant activity with NAC and reducing beta-glucuronidase activity with calcium D-glucarate. And finally, the last step is to work on phase 1 activation. Use the hormone zoomer to investigate phase 1 estrogen metabolites. Use nutraceuticals like sulforaphane, NAC, and resveratrol to push the pathway that's best for your patient. Meanwhile, of course, all the work on overall diet, lifestyle, movement, and stress management, the foundational pillars of health, as toxic burden doesn't just come from the environmental toxins, mycotoxins, and heavy metals. Toxic relationships and social environments can also contribute to the total body burden. And that's it. Thanks for your time and attention. Please let me know if you have any questions.